Welcome to our presentation on NeuroLynQ validation. Jeff Gill is presenting. This is the fourth in a series of mini presentations. In the first, we discussed the importance of System 1, or non-conscious processing, to market researchers. The second presentation discussed using biometrics to measure System 1 activity, and the third presented the specific metrics we developed for NeuroLynQ. Literally thousands of studies have demonstrated the validity and reliability of biometrics in general. We do not aim to replicate these studies in this presentation. Instead, we will review some of the validation studies we have done on the specific NeuroLynQ metrics to prove that our specific metrics and procedures are both valid and reliable. The final presentation discusses why Shimmer believes that biometrics will become the dominant neuromarketing technology. The first question is whether NeuroLynQ provides a true measure of arousal. What better way to look at this than to measure a live athletic event? In the US, there is no bigger event than the Super Bowl, so we monitored 45 Patriots and Eagles fans throughout the 2018 Super Bowl. On average, 44% of the audience was having a response at any point during the game, with a standard deviation of 14 percentage points. The horizontal bar represents the average, and the vertical bar provides the standard deviation. Of course, these statistics don't mean much unless you compare them to something, so we looked at what happened during touchdowns. We identified the peak response rate in a 10-second window around the touchdown and found that we reached an average peak of 90% of the audience responding with a standard deviation of 6 percentage points. This is over 3 standard deviations above the average response rate. So it is clear that our metrics differentiate between touchdowns and average plays very well. But what about field goals? They average a 64% peak, about 1.5 standard deviations above the average play. As an American football fan, this makes total sense to me. Field goals are for fewer points than touchdowns, and everyone knows when a field goal is going to happen because they set up the play. Furthermore, you know that they have about a 90% chance of making it if the kick is from less than 40 yards away. So there is little surprise in field goals. Still, they are more exciting than the average play. But what about advertisements? Well, this was the Super Bowl, and companies were spending $5 million for 30-second ads. But not surprisingly, they were less exciting than the game itself. In fairness to my international colleagues, we had to compare these responses to international football, which I will now call soccer to differentiate it from US football. We measured 42 fans of soccer in London while they watched France and Peru World Cup game. Their average response rate was 38%, below the Super Bowl. Before my US colleagues claim victory, I should mention 2 things. First, they hit a peak of 98% response in the one goal that was scored, higher than the average for the football touchdowns. Second, the participants were fans of soccer, but not of the 2 teams, France and Peru. To make the comparison fairer, we need to get fans of the particular teams. Where better to go than Mexico City, where the response to a Mexican goal during the World Cup game literally registered on the Richter scale. So we monitored 16 fans of Mexico in Mexico City during the Mexico-Brazil World Cup game. Here, the average response rate was 49%, higher than the Super Bowl. And the response to goals was also higher. Of course, the response to halftime ads was lower than the game. Finally, we wanted to compare all of these stimuli to something we test more frequently, a half-hour TV sitcom. Turns out that the sitcom was the lowest of all stimuli tested. Not surprisingly, the sitcom was canceled shortly after our study. So what does this all mean? The first thing is that NeuroLynQ can differentiate very well between exciting and boring periods in a game. The metrics that we use seem to do a really good job of quantifying excitement. Furthermore, we were able to compare different stimuli on the same scale and have it all make sense. Finally, audience effects can be measured. There's no question that the London audience was less excited than the Mexican audience, and our metrics reflected that. So we feel very comfortable that we are measuring arousal accurately in large audiences in real time. Just from glancing at the results, you can tell the big effects like touchdowns or goals are easily identified reliably in these studies. This is great, But the real question is whether these metrics are reliable for the types of stimuli companies really want to evaluate. Fortunately, we had data from a study we did on a sitcom. We monitored 51 people in total over 7 sessions, each with between 4 and 10 people in a focus group facility. The demographic was very broad. Basically, they just had to like sitcoms. We then defined a major peak as a peak in response rate that was more than 1 standard deviation above the average response rate. When we looked at each of the sessions individually, we found that on average, 90% of the major peaks in the full sample were reflected in each of the individual sessions. If we combine the individual sessions in multiple ways to get a total of about 20 participants, we found that 98% of the major peaks were reflected in the subsample. Bottom line, you will not miss any significant move if you collect data from only 20 people. With smaller subsets of groups, however, you may get some false positives. We found out that 9% of the major peaks in the subsamples were not reflected in the full sample. This makes sense. If someone coughs in a session or laughs in an unusual place, the rest of that session will likely respond. This would get washed out in the whole sample, but would have a larger impact on the subsample. I would note that we specifically chose to combine the specific sessions to create our subsamples so that we could evaluate this effect. When we selected 2 to 3 participants at random from each session, our false positive rate dropped to 3%. Conversely, we found no major peaks during a period of low response in any of the 20-person subsets. This means that if your subset is not responding, it's very unlikely that you'll get a response in the larger sample. Our bottom line conclusion is that you need a sample of about 20 people to get repeatable results. We hope you enjoyed this discussion of NeuroLynQ's validity and reliability. If you want to learn why we think that biometrics will become the dominant neuromarketing technology, please view our next presentation in this series.